Hello, everyone, and welcome to Question Lab. We're happy to have you here. Tonight's topic is microbiology, and leading our discussion once again tonight is Dr. Paras Vakaria, and he's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I'm a current dermatology resident here in Dallas, Texas. I originally graduated from pharmacy school and then went on further to do medical school back home in Michigan. I am also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you guys for the USMLE Step 1 and Step 2 CK as well. And I'm happy to help lead tonight's session.
I know I mentioned RX Coach earlier. RX Coach is our one-on-one coaching and tutoring program. We'll talk more about that later. But what I want you to know for now is that the methodology we're going to employ as we tackle these 4 questions this evening on the topic of microbiology is very similar to the methodology that we use in RX Coach. So without any further ado, let's begin with our first question of the evening on the topic of microbiology. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. We don't want you to see an answer choice that you're unfamiliar with, which may cause you to panic as you're trying to answer the question on test day. So we've gone ahead and removed those answer choices. After that, we'd like to begin with the lead-in, which is the last sentence or the question itself. And the reason we do that is because we want you to know what the test writer is asking. This way, as you're reading that vignette, you can pick up on all of those relevant clues and not have to reread that question and waste time on test day. So let's take a look at that lead-in now. Which of the following organisms is most likely responsible for this patient's illness? Which of the following organisms is most likely responsible for this patient's illness? After we read the lead-in, we like to ask our students how many steps they believe the question will require. An example of a 1-step question is when you're asked for the diagnosis. An example of a 2-step question is when you're asked for the treatment for a diagnosis. And an example of a 3-step question is when you're asked for the mechanism of action for a treatment for a diagnosis. So with that in mind, I'll give all of you a few seconds here to respond in the question box and let us know how many steps you believe this question will require. Once we get some submissions here, we'll go ahead and read that vignette. So I'll give you a few moments now to let us know how many steps you think this question is going to require. You can simply enter 1, 2, or 3 in the question box to let us know. All right, I see some responses coming in. So let's go ahead and get started with that vignette. A 1-year-old girl is brought to the emergency department because she has been crying more than usual and refuses to eat. She has not seen a physician or received any vaccinations since birth. Temperature is 39.4 degrees Celsius or 102.9 degrees Fahrenheit. Analysis of the cerebrospinal fluid shows opening pressure of 187, a white blood count of 1256, protein level of 210, and a glucose level of 31. Which of the following organisms is most likely responsible for this patient's illness? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in, okay? And now starting off, generally the first thing you're going to get are demographics in a clinical question. And in this case, it's a 1-year-old girl. So you want to make note of those demographics because that automatically is going to tell you what kind of patient you're dealing with and what kind of things you should be thinking about right off the bat. So right off the bat, we know this is a pediatric case. And then usually they tell you, why are they coming to the hospital? Why are they being seen in the ER? And in this case, it's because she's crying more and she's not eating, okay? So those are what we call presenting signs and symptoms. And you want to make note of that because those are really the main things that brought them in to be seen. So that's basically the crux of what is going on, what you're being told first. A lot of times, not in this question, but a lot of times they'll also tell you how long it's been going on for, a few days, a few years, so you can get a sense to the chronicity of a disorder as well. We're not told that here, but you want to keep an eye out for that if they do, okay? Now, we are told some important information. She hasn't seen a physician, hasn't received any vaccinations, So you definitely want to make note of that and start to think about how that could be playing a role potentially in this clinical vignette, okay? We're told some important information about vital signs, about CSF findings. You definitely want to know how to interpret CSF findings. Those are definitely fair game questions that they love to ask about, okay? So in this question, they're asking about the organism most likely responsible for the illness. You can see that we've highlighted those key phrases, organism most likely responsible. So I think we've got a couple steps here. I think one, we've got to figure out what condition this patient has. And then two, what organism might be most responsible for that condition. So what's the condition? And two, the most likely organism, okay? So let's go ahead and let's take a look at those answer choices. And what we see here are 5 answer choices. And when we work with students, we actually recommend that they start at the bottom, answer choice E, and work their way up to the top, answer choice A, okay? And the reason we do this is because a lot of times we'll see students who, they'll start at the top, they'll see something they like and select it without having gone through all the answer choices. And sometimes they'll get that question wrong as a result. So we recommend doing it this way to prevent yourself from biasing yourself and to not make that same mistake, okay? So let's go ahead and let's do that now. Answer choice E, Listeria monocytogenes. D, herpes simplex virus. C, Haemophilus influenzae. B, group B streptococci. And A, E. coli or Escherichia coli. So we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. The poll is open. We're going to wait until about 2/3 of you have responded. If you're not sure what the answer is, remember that there is no penalty for guessing on test day, so never leave a question blank. And if tonight you're unsure, don't worry, take your best guess, and we will review the correct and incorrect answers shortly. As always, we do have a raffle and special offer at the end for all of you in attendance, so make sure you stick around because you must be present to win. I see the responses coming in. We'll give all of you a few more moments here. All right, let's see what all of you selected. Looks like the clear favorite here with 51% was Haemophilus influenza, answer choice C. And in second place, we had group B strep. So let's take a look and see what the correct answer is. And the correct answer is indeed C, and 51% of you got it right. So great job, everyone. Let me hand it off to Boris.
Thank you, Sean. So let's go ahead and let's take a look at this question. Seems like a lot of you guys were on the right track with this question, okay? So the key phrases here are this patient has not seen a physician, has not received any vaccinations since birth. So you want to be thinking about a lot of those diseases that normally can be prevented or reduced incidence with vaccinations, one of which, as we know, is Haemophilus influenza, okay? However, we also need to figure out step number 1. What is the illness that this patient has, okay? Now, keep in mind, a 1-year-old isn't going to tell you, hey, my head hurts, hey, I'm having vision problems. So you have to look for those other signs and symptoms that they might have meningitis, crying more, not eating, okay? And in this case, we are told about those abnormal CSF findings. If you take a look, you can see here that there is a decreased glucose level, okay? And there is an elevated white blood cell count, okay? That, along with the elevated protein, suggests a bacterial cause of meningitis. And you can see here, the majority of these answer choices were also bacterial, okay? But now we need to know, okay, if this is a bacterial meningitis, what's the most likely organism? Well, one of the things that you kind of need to know are the most common pathogens for meningitis by age group. So let's take a look at the next slide. If you see on the next slide, the most common causes of meningitis in this patient's age group, 6 months to 6 years, would be Streptococcus pneumoniae, Neisseria meningitis, and Haemophilus influenzae type B. Okay. Now you can see there at the very bottom, it says the incidence of group B strep meningitis, as well as H. influenza meningitis, has decreased. And H. influenza meningitis has decreased due to vaccination. So cases are usually seen in unimmunized children. So you definitely want that to be ringing in your ears when you see that in this question. So if we go back to our question, hopefully you guys can now see why that's the best answer choice. Okay. The other answer choices, Listeria, answer choice E, that's common as for meningitis in either patients who are above the age of 60 or newborns, so 0 to 6 months. HSV, that can be a cause of meningitis in infants. However, the CSF findings would show normal glucose, low white blood cells or lymphocytes, not what we're seeing here. Group B strep and E. coli can cause bacterial meningitis, but again, the things that we want to keep in mind here are the unvaccinated status, probably pointing more towards Haemophilus influenzae. Okay, so great job on this question.
Well, thank you very much, Paris. Yes, great job indeed. With a tough question, let's move on now to question number 2 and see if we can't keep the momentum going. Once again, the answer choices have been removed, and we will begin with the lead-in. Which of the following is the most likely cause of this patient's condition? Which of the following is the most likely cause of this patient's condition? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. And then we'll move on to that vignette. All right, I see some responses coming in. We'll give all of you a couple more seconds here. All right, let's take a look at that vignette. A 27-year-old male presents to the clinic with tender bumps in his groin for the past 2 days. He had unprotected intercourse with both men and women while on vacation in the Caribbean 1 month ago. He recently noticed a small painless ulcer on his penis which resolved on its own. Physical examination reveals bilateral, tender, inguinal lymphadenopathy with 2-centimeter overlying ulcerations. Which of the following is the most likely cause of this patient's condition? Faris.
Thank you, Sean. So now let's go ahead and talk about what we think are the important clues in this clinical vignette. Now in this case, we've got a little older patient, a 27-year-old male, okay? So a young male adult. As you can see, one of the things that you might want to be thinking about is sexual activity, okay? And in this case, they do tell us this patient's coming in because of tender bumps in the groin, okay? On top of that, we are given some information about chronicity. We were told this has been going on for 2 days, okay? So we know this is more of an acute issue. We're told about some risk factors, unprotected intercourse, sex with men and women. We're told about where he traveled. We're told even about physical exam findings of what it presented like, what he now has. And so these physical exam findings are going to be very important when you're trying to come up with this diagnosis, okay? But as Sean pointed out, when you read that question, it was more than just a diagnosis question. 1, we need to figure out what's the diagnosis or condition. But then 2, so a second step, what is the cause of that condition? So I think this is a 2-step question here. So you definitely want to be thinking about that. And that's one of the reasons why you read that lead-in first, is so you can start to be thinking about that as you go through the question. So let's go ahead and let's take a look at those answer choices. And once again, we will start at the bottom and we will work our way up to the top. Answer choice E, Treponema pallidum. D, Klebsiella granulomatis. C, herpes simplex virus. B, Haemophilus ducreyi, and A, Chlamydia trachomatis. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Faris. Once again, the poll is open, and we're going to wait until about 2/3 of you have responded. I see the responses coming in. Doesn't seem to be a very clear favorite yet, but it is leaning one way. For those of you just joining us, we do have a raffle and special offer for all of you in attendance. So make sure you stick around until the end because you must be present to win. All right, well, let's take a look and see what all of you selected. 34% of you selected Treponema pallidum. In first place, that was answer choice E. In second place was 28% of you picked chlamydia. So let's take a look and see what the correct answer is. And the correct answer is E, chlamydia, and 28% of you got it right. So great job, everyone. Definitely a challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a challenging question, but I'm glad you guys are on the right track. So let's take a look at what's going on. This patient likely has a condition called lymphogranuloma venereum, or LGV, okay? Now this patient has some risk factors, okay? This patient has a history of unprotected intercourse, and we also know the patient had a painless ulcer that now developed into tender inguinal adenopathy with ulceration, so ulcerated lymphadenopathy, okay? We're also told about area, location. This happened in the Caribbean. Lymphogranuloma venereum commonly occurs in the tropical, subtropical areas, okay? So if we take a look at the next slide, this is actually a nice summary on the various subtypes of chlamydia trachomatis, okay? It is important to know this because this is one of the common ways they will trip you up. They will give you a couple answer choices with type A, type K, and you need to remember which one can potentially cause which condition. Now, in this case, it is type L1 to L3 that can cause lymphogranuloma venereum. You get a small painless ulcer. Now, it's important to also keep in mind which genital ulcers are painful and painless. This is a painless ulcer. However, it does then go on to become what we call buboes, where you get ulcerated lymphadenopathy, especially in the inguinal areas, okay? So this is a very classic description that they gave us of lymphogranuloma venereum, okay? So we needed to know then also that it's chlamydia trachomatis. They could have taken it a step further and asked us to know which subtypes. So it's important to know that as well. You can see there the nice mnemonic, L for lymphogranuloma venereum, okay? Now if we go back to our question, some of the other answer choices, why those are not correct. Treponema pallidum is talking about syphilis. Keep in mind that does commonly present as a painless ulcer, but you wouldn't normally then present with these buboes or ulcerated lymphadenopathy in the groin. That's a little bit more characteristic of LGV. Klebsiella granulomatous, that's the cause for granuloma inguinal, okay? Again, that can present as a painless ulcer, but again, there wouldn't be that ulcerated large inguinal adenopathy. HSV, answer choice C, this is a cause of genital herpes, which is presenting with painful vesicles, so a little different than what we have here. Haemophilus ducreyi, that's the cause of chancroid, and that can present with bilateral adenopathy as well. So if you selected that, I can see maybe why you did, because that does present similarly at the late stages. However, that genital ulcer is usually painful to begin with. So they like to differentiate that as well. So make sure you know which ones are initially painless versus painful, okay? So great job with this question as well. We will move on to question number 3 after a short message from Sean.
Well, thank you very much, Boris. You know, we get a lot of students who tell us, I'm studying, but I'm not, the efforts aren't really matching my results. Or can I be more efficient? Or, you know, the test just went pass fail. Can you help me just get through? And what's the best way for me to get that passing score? Or, you know, I'm studying for step 2 now, and I know the scores are going to be looked at more closely because residency is going to look at them, and FMGs are going to apply too for those, and they sometimes have more clinical experience. So how can I get an edge on step 2? How can I maximize my potential and get the best possible score and set myself up for successful residency? Or I'm in medical school right now, and I'm falling behind or not doing quite well on my block exams. I'm studying for a shelf and I need some help, but I'm not sure how to go about it. Well, we're here for you. Whether you're studying for in-school exams, your shelf exams, your board exams, your COMLEX, we're here to help you create a personalized study plan based on your strengths and weaknesses, identify your knowledge gaps, bridge them, work on your test taking skills, and make sure that you're studying efficiently and effectively to get to where you want to be. If you're interested in working with the coach, reach out to us at rx-coach.com. Set up that free consultation. You can talk to us about the program and see if it's a good fit for you. If you're studying for a board exam or a comprehensive shelf, we'll start you with one of our 160 question assessments. And we're one of the only tutoring companies out there that was in medical education prior to getting into tutoring. That means we have 30 years of experience and data that we can use to really hone in on your study plan to make sure that you're being efficient, you're getting to where you want to be, and we can take the guesswork out of studying, okay? We'll give you that personalized study plan. You'll work with us one-on-one with one of our highly trained, certified tutors like Forrest or Brian, and of course, we'll give you access to all of our resources. And one of the questions we get is, oh, do we have to use only your resources when we get tutoring? The answer is no. You'll actually fill out an intake form. You'll let us know what resources you have. We'll ask you about your learning style, and we'll incorporate all of that as part of your personalized study plan. Your plan will be different from everybody else's because we take the individuality of each person into consideration. You can go online, you can read, oh, this worked for this person or this worked for my friend. But remember this, everybody's different. Everybody learns differently, everybody studies differently, everybody has different learning styles, and everybody applies what they know differently. So because we're USMLE experts, we can take that guesswork out of studying, because after all, what worked for your friend or what you read online for somebody else may not necessarily work for you. And we want to help you get to where you want to be, because this world needs more competent physicians, and we're here to help you do that, as we have been for the last 3 decades. So if you want help from one of our coaches, reach out to us at rx-coach.com. Click on that free consultation tab so we can talk about the program and see how it can benefit you best. All right, once again, that's rx-coach.com. Let's go ahead and get into our third question for the evening on the topic of microbiology. Once again, we're going to begin with the lead-in. Which of the following mechanisms is used by the toxin most likely responsible for this patient's symptoms? Which of the following mechanisms is used by the toxin most likely responsible for this patient's symptoms? I'll give all of you a few more moments, as always, to respond in the question box, and let us know how many steps you believe this question will require, and then we'll move on to that vignette. All right, I see some responses coming in. Let's take a look at that vignette. A 12-year-old female was brought to the emergency department because of bloody diarrhea for the past 3 days. Her symptoms began after eating a home-prepared hamburger. Her temperature is 38.3 degrees Celsius or 100.9 Fahrenheit. Pulse is 125 per minute. Respirations are 16 per minute. And blood pressure is 125/70. Physical examination shows petechiae on her extremities and chest. Laboratory studies are as follows. Hemoglobin 9, leukocyte count 12,000, platelets 50,000, prothrombin time 12 seconds, international normalized ratio of 1, partial thromboplastin time of 33 seconds, fibrinogen of 327, and they give you the normal range there, serum creatinine of 2.3, and lactate dehydrogenase of 120. The patient is successfully treated with plasmapheresis. Which of the following mechanisms is used by the toxin most likely responsible for this patient's symptoms? Boris.
Thank you, Sean. So what we're going to do now is kind of walk you through this case. Now you can see this is a little bit of a longer clinical vignette with a lot of laboratory values, okay? So as you get to that, don't be overwhelmed. Just know that you're going to have to go through those very delicately. Use your reference range if you need to, okay? Now in this case, this is a 12-year-old female, and she's coming in because of bloody diarrhea, okay? So right off the bat, you want to start thinking about things that could cause bloody diarrhea. Hopefully you have, some things in your mind in that differential. We're also told this is a little bit of an acute issue, 3 days, okay? So not something that's been going on for months. We're also given a little bit more information about this happening after eating a home-prepared hamburger. So hopefully you guys are starting to clue in on what could potentially be causing this. We're told about some vital signs, physical exam findings, and then importantly, you see there, as we talked about, a lot of lab values. So you want to make sure you're going through that, figuring out which one is abnormal, which one is normal but still helpful, what we call a pertinent positive or pertinent negative, okay? So even though it's not abnormal, it's still relevant, okay? Now in this case, we're told then she's then treated with plasmapheresis. So this question is asking us about the toxin that was responsible for the symptoms. But they weren't asking about what type of toxin or the name of the toxin, they're asking about the mechanism of that toxin, okay? So it's important to then read that and make sure you're picking up on that. So how many steps is this question? Well, one, I think we need to figure out what's responsible for the symptoms. So what's the condition, the diagnosis here? 2, what is the toxin responsible for that? And then 3, what is the mechanism of action of that toxin? So I think we've got a nice 3-step question here. So let's go ahead and let's take a look at the answer choices. Once again, we will start at the bottom, we'll work our way up to the top. Answer choice E, super antigen binding to major histocompatibility complex 2 protein and T cell receptors. Make sure you read that one thoroughly. Answer choice D, overactivation of adenylate cyclase. C, increasing the release of acetylcholine. B, inactivation of ribosomes. And A, inactivation of elongation factor 2. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds. I'll also go ahead and read that last answer choice for you since it was a little long there. Answer choice E, super antigen binding to major histocompatibility complex 2 protein and T cell receptors.
Well, thank you very much, Paras. Poll is open. We'll wait once again until 2/3 of you have responded. We're getting close now to our last question, which is our next question, and of course, we'll have a raffle. For those of you wondering, next week's topic is pharmacology, and we do have a special webinar tomorrow night, and I believe Jeff is going to put the link in your chat, and that webinar is about secrets of the USMLE Step 2. So we're going to give you some tips on how to study best for Step 2 and make sure you have an edge there. So if you're around tomorrow night, please join us. And let's see what you selected, and it looks like it was very close. 25% of you selected inactivation of ribosomes and overactivation of adenylate cyclase. So we had a tie. And second place was super antigen binding to major histocompatibility complex 2 protein and T cell receptors. So let's take a look and see what the correct answer is. And the correct answer is B, inactivation of ribosomes, and that was tied for first place with 25% of you selecting that. Once again, a challenging question. Let me hand it off to Paras.
Thank you, Sean. Yes, definitely a tough question. So what's going on here in this patient? Well, hopefully you guys picked up that this patient was having some sort of infection, maybe from eating a home-prepared hamburger, okay? Now, this patient has a few things you want to pick up on. This patient is tachycardic. Patient also, importantly, has a fever, okay? And if you take a look, that hemoglobin and platelets, those are pretty low, okay? This patient is anemic, she's thrombocytopenic, okay? Also has petechiae on the skin, which is another sign of low platelets, okay? And we can also see here that the patient has elevated creatinine, 2.3, that is high for a 12-year-old, okay? So this patient has some condition of which we would be concerned for hemolytic uremic syndrome, okay? This is something that can be seen in the setting of E. coli, one specific subtype, okay? If we take a look at the next slide, we can see here that the very last EHEC, or enterohemorrhagic E. coli, 0157H7, the most common serotype in the US, transmitted via undercooked meat. Now, the toxin can cause hemolytic uremic syndrome. So you can get anemia, thrombocytopenia, and acute kidney injury, okay? Now, if this patient were to have a peripheral blood smear, you might also see schistocytes on that, okay? This patient has those signs and symptoms, okay? So this is something that you would need to know in order to answer this question right. Now, it's one extra step here is what is the toxin do? Now, this is a Shiga toxin. Shiga toxin enters your intestinal cells and inactivates ribosomes, okay? The best answer with this question would have been answer choice B. If we take a look at the other answer choices, most of those are just distractors. Okay? If we take a look at answer choice E, the long answer choice, super antigen binding, that was talking about toxic shock syndrome caused by Staph aureus. Okay? So a little bit different than what's going on here. We'll take a look at those answer choices once again, and then Sorry, can you hear me now, Sean?
We can now. Sorry, we lost you there for a moment, but please continue.
No worries. Yep. So let me just recap. Answer choice E, that's talking about toxic shock syndrome caused by Staph aureus. Answer choice D, that's talking about something such as Bordetella pertussis, which causes whooping cough. Answer choice C, not so much relevant here. And then lastly, answer choice A, an activation of elongation factor 2. This is something that could be describing diphtheria. So something, the exotoxin of Corneobacterium diphtheriae, which obviously is a little bit of a different condition here. So the best answer choice here would be B, but it does require a few steps to get to that answer choice. So keep in mind, it's important to get step 1, step 2, and step 3 right in all of these questions.
Well, thank you very much, Boris. One mnemonic I like to use for hemolytic uremic syndrome, which is HUS, is hamburger, undercooked, sick. So hamburger, undercooked, got sick, HUS. If you like it, use it. If not, you don't have to. Let's move on now to our fourth and last question of the evening on the topic of microbiology before we move on to our raffle and special offer. As always, we will begin with a lead-in. Which of the following organisms is the most likely cause of this patient's condition? Which of the following organisms is the most likely cause of this patient's condition? As always, I'll give you a few moments here to respond in the question box and let us know how many steps you believe the question will require. All right, I see some responses coming in. Let's take a look at that vignette. A 5-year-old boy is brought to the emergency department with a 4-day history of abdominal pain and diarrhea. 3 weeks ago, he traveled to the Philippines and went swimming at his grandparents' lake house. Temperature is 38.4 Celsius or 101.2 Fahrenheit, and physical examination demonstrates tenderness to palpation of the right upper quadrant. The serum alkaline phosphatase is normal, and a complete blood cell count shows elevated eosinophils. Microscopic analysis of the stool sample reveals eggs. Which of the following organisms is the most likely cause of this patient's condition? Boris.
Thank you, Sean. So once again, we're going to show you what we think are the important clues in this vignette and the lead-in. Okay. Now, we've kind of gone through this 4 times. We're showing you what we think are the important clues as you go through a vignette and as you go through that lead-in. So hopefully you guys are starting to pick up on, really what you should be taking note of as you go through that and how to dissect these questions. So hopefully this was helpful for you guys today. Once again, we'll kind of walk you through this question. So this is a 5-year-old boy. Okay, so again, a pediatric case. His presenting signs and symptoms are abdominal pain and diarrhea. And we're told it's been going on for 4 days, so a little bit of an acute nature here. Again, we were told about some travel history, some exposure history, vital signs, physical exam findings that are abnormal, okay? You want to make note of that. You want to make note of anything that could clue you in as to what's going on in this question, okay? And this question, as Sean read, was asking about not just the diagnosis or the cause or the name of the condition, but the organism causing it. Okay, so a nice 2-step question. 1, the condition. 2, the organism most likely causing that. Okay, so let's go ahead and let's take a look at those answer choices. Once again, we will start at the bottom and we will work our way up to the top. Answer choice E, Strongyloides stercoralis. D, Schistosoma japonicum. C, Loa loa. B, Clonorchis sinensis. And A, Ascaris lumbricoides. So we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. This is our last question of the evening. Let's try to finish strong. My hat's off to Boris for pronouncing all of those correctly. I know I would have a problem doing that myself. All right, a few more moments here. I see about half of you have responded. We'll give all of you a few more seconds. All right, let's take a look and see what you selected. 42% of you selected schistosoma, answer choice D, and 27% of you selected answer choice A as scarce. Let's take a look and see what the correct answer is. And the correct answer is indeed D, and 42% of you got it right. So great job. Let me hand it off to Forrest so he can give us an explanation. Forrest.
Thank you, Sean. Yes, absolutely. So let's take a look at what's going on in this question. So another tough question, especially when we're starting to get into the nitty-gritty of microbiology. But they're all fair game. Okay? And this is really how you can do well and succeed on these exams. So in this case, this patient has fever, right upper quadrant pain, and diarrhea. Okay? So a few things. And we're told about traveling to East Asia and swimming in fresh water. Okay? So you would want to think about acute schistosomiasis. Okay? Let's take a look at the next slide. And this is kind of talking about a fluke infection or a trematode infection, such as schistosoma. Okay? Now, schistosoma japonicum, you obviously might see this more in East Asia. Okay? These patients present with abdominal pain, with diarrhea. They can even have iron deficiency anemia if it's been going on for a long time. Okay? So these are all things that you would want to think about. You can see there that it's transmitted in contact in contaminated fresh water, so swimming or bathing in fresh water. Okay, so all of these kind of point to this condition. Okay, now if we take a look at the other answer choices, you might also need a little bit of help in ruling some of them out. So answer choice E, this usually causes more pulmonary symptoms along with GI symptoms. Okay. Loa, that causes more swelling of the face and extremities, so more of an edematous swelling condition. Answer choice B, that is something that usually presents with jaundice, not a very common infection and not something you would see in that area with that exposure. And lastly, answer choice A, this you would also be on the lookout for respiratory symptoms, obstruction of the pancreatic or biliary duct, other things like that. So the exposure history, where they were at in East Asia, and then also the eggs that you see on the stool sample all really kind of favor answer choice D. Definitely a tough question, but they love to ask questions this way. So great job on tonight's micro questions. I will pass it back to you, Sean.
Well, thank you very much, Forrest. And thank you all for attending. We're not quite done yet. We still have a raffle, but before that, if you want to study these topics in more detail or review them once again, feel free to make note of these question IDs, take a picture, take a screenshot, write it down. And if you go to RX, log in, you can type these QIDs into the search field and it'll pull those questions right up for you. So I'll give you a few seconds to make note of these QIDs.